Hello everyone, welcome to Module 5, The Art of Framing MCQs in Medical Education. I am Dr. Aditya Agnihotri, Associate Professor Pathology and member of the Medical Education Unit at SDM College of Medical Sciences and Hospital, Sri Dharmasthala Manjunatheshwara University. In this module, we will explore how to construct high-quality MCQs that accurately evaluate learner competency, reflect real-world decision-making, and support competency-based medical education. At the end of the session, we will try to achieve four objectives. The first being identify the principles of validity and reliability in MCQ construction. Here we will understand how MCQs can be designed so that the assessment accurately measures intended learning outcomes, which is validity, and also performs consistently across students and exam attempts, that is reliability. Frame clear stems and meaningful distractors using best practices in MCQ construction, wherein we'll focus on constructing a precise stem and writing distractors that are logical, plausible, and meaningful. Recognize and correct technical item flaws. Here we will learn how to avoid common flaws that reduce fairness or increase guessing, such as grammatical cues, impossible distractors, or unnecessary complexity. And lastly, design authentic scenario-based MCQs for CBME, wherein creating clinical vignettes that reflect realistic patient care and test higher order cognitive processes aligned with CBME expectations. There are three core principles in high quality MCQ design: validity and reliability, wherein MCQs can actually sample a wide content domain with very high reliability. When well constructed, MCQs provide valid, objective assessment of competencies. But we should ideally shift from the recall-based MCQs to questions that assess application, analysis, and synthesis of knowledge. So in a high-stake exam, the recall type MCQ should ideally be restricted to less than 10%, because our aim is to assess what the learner can do with the knowledge rather than what they can memorize. This slide shows the Bloom's hierarchy applied to MCQs, wherein the lower order learning, which includes remember and understanding, are usually assessed with recall type MCQs, and the higher order learning skills, which includes application, analysis, evaluate, and create, are usually assessed using scenario based MCQs. Some cognitive tasks like create are very difficult to assess with MCQs, but a carefully designed clinical vignette allows us to target even this level. Here's an anatomy of an MCQ. An anatomy of an MCQ consists of the following parts: the stem or the vignette, which provides the context or the clinical scenario; the lead-in, which is also a component of stem, which states the task. For example, which of the following is the most likely diagnosis; and the option set, which includes one key, that is the correct answer, and multiple possible distractors. Let's look at an example. This example demonstrates a focused clinical vignette with relevant findings. The lead-in is very clear and closed, and the option set are homogeneous with one key and other plausible distractors. The following are the principles which guide good STEM writing: clarity and focus, wherein the clinical vignette or the STEM should present a single clearly defined problem; cover the options test, wherein the learner should be able to answer the MCQ even without looking at the options; relevance and conciseness, wherein we should include only the essential information and avoid window dressing; we should prefer direct questions or full sentences and not fill in the blanks; use positive phrasing and avoid words like not, except, or the least likely. If we have to use it, we should always be emphasized and highlighted to prevent misinterpretation. Clinical vignettes should use realistic patient scenarios and include age, genders, clinical setting, chief complaints, history, key findings, and relevant investigations. The lead-in should always be very clear and focused and closed. For example, ask for the most likely or the best answer. The common wordings were to place the shared phrases in the stem and not repeated in the options to improve clarity. Options should be designed as follows. The plausibility. All options should appear reasonable to the less prepared learners. Homogeneity. All options must belong to the same conceptual category. Mutual exclusivity. Options should not overlap in meaning. Consistency. The options should be parallel in grammar and also in length and complexity. Logical order. Wherever it's applicable, arrange options either numerically, chronologically, or physiologically. Ideally, we should have only 4 to 5 options. Avoid terms such as always and never, or vague qualifiers such as usually or sometimes should always be avoided. Composite options like all of the above or none of the above should never be used because they promote guessing. Flaws that increase difficulty for the wrong reasons include long, complex options that burden reading, non-parallel options where grammar structure is inconsistent, inconsistent numerical data where, an example, mixing of percentages and frequencies, vague qualifiers that obscure meaning. These flaws do not test knowledge, they test reading stamina, which reduces assessment validity. Here are the flaws that make guessing easier, which include grammatical cues wherein only one option fits the stem sentence structure, word repetition, repeating a phrase from the stem in the key option, the correct option being longer or more detailed than the distractors, convergence, where the correct answer combines elements of multiple distractors, absolute terms, which are very easy to eliminate. These flaws advantage the test-wise examinees and not the knowledgeable learners. Planning and blueprinting. Blueprinting ensures content balance and cognitive levels alignment because it maps MCQs to topics, learning objectives, and Bloom's levels. We have to ensure that each MCQ corresponds to the meaningful learning outcomes which supports validity and fairness, and always should be framed using the SMART objectives, that is specific, measurable, achievable, realistic, and time bound. Use of media in MCQs. Here, the principle is purposeful use of media. Media should be used to enhance authenticity and test the real world interpretation skills, not just recall. It should represent realistic clinical scenarios wherein the media should aid decision making and not distract. Replace long descriptive text. Let's look at an example. In this stem, the scenario describes ptosis, meiosis, facial anhidrosis, and history of neck pain. This requires the learner to apply clinical reasoning to localize the lesion to the superior cervical sympathetic ganglion. So this vignette tests application and not simple memorization. Now let's look at this modified version. In this variation, the clinical signs in the stem have been represented in an image. This tests whether the learner can interpret visual findings to reach the same anatomical conclusion, which is the superior cervical sympathetic ganglion. So the image-based MCQs should remain diagnostic reasoning tasks and not label recognition tasks. To design effective scenario-based questions, we have to first develop a blueprint, match case complexity to the learner's level, align questions to the intended learning objectives, focus on common or potentially catastrophic problems, create realistic clinical scenarios which mirror real-world situations, encourage higher order thinking skills, provide precise references for every question that we frame, review and pilot test all the items before putting them to the assessment. Here's a redundant MCQ example, wherein this example shows a redundant vignette. The scenario does not influence the answer in any way. If the same question can be answered without the scenario, the vignette should be removed or redesigned. Here's how to do the cover test. This thyroid case demonstrates the cover test, wherein the scenario contains all the relevant clinical findings and the learner can answer the question even when the options are covered. This indicates a very well designed clinical vignette. Here is how we build a clinical scenario. The clinical case may begin with presentation of a problem and followed by relevant signs, symptoms, results of diagnostic studies, initial treatment and subsequent findings. The relevant components have to be added, but it is not mandatory to add all the clinical details. Ensure that the sentences are always complete, relevant to the learning objectives, are following a single theme and not overloading with multiple concepts. Grammatically, it should be consistent. Avoid abbreviations and acronyms. I repeat, avoid abbreviations and acronyms. Avoid textbook and verbatim phrasing as well, because that encourages recall rather than reasoning. Here is another MCQ with an incomplete stem. If you go through this case scenario, a 22-year-old adult visits a dental clinic with a complaint of discoloration of teeth. On examination, it was observed that the premolars and molars with small opaque paper white areas scattered irregularly over the tooth enhanced near tips of the cusps with bilaterally symmetrical presentation. So which of the following is the most likely diagnosis is the key. Here the stem needs more details for better clarity because the duration is missing, the texture of the opaque areas is missing. Is the white area visible or not after water spray? That is not described. Basically, it's an incomplete stem because if a learner cannot arrive at a logical conclusion at the end of the clinical scenario, the stem is incomplete. Concept-based MCQs for professional year 1 and 2. In early foundational years, students are developing core conceptual understanding and not full clinical reasoning because their clinical postings have not started yet completely. The scenario-based MCQs can be short and focused only on the concepts. So the emphasis is on assessing mechanisms, pathology, and foundational relationships, and not clinical reasoning. Here is an example. This item tests recognition of histopathological morphology and its integration of the microscopic appearance with the type of necrosis. This tests understanding and not recall. Now let's take an example of tuberculosis and frame MCQs for the same concept across all the Bloom's levels. So the question that you're seeing now, the causative organism of tuberculosis, is purely a recall type question. So this tests the lowest order of the Bloom's hierarchy, which is remember level. Recall questions are acceptable but should never dominate in the summative exams. Ideally, they should be less than 10%. Now let's move a little higher to the understand level. This question tests the recognition of case-sheeting granulomas and identification of epithelioid cells and Langerhans type of giant cells. So here it is at an understand level wherein the patient student has to understand the morphology of the disease and link it to the disease. Now as we progress higher away from the lower order thinking skill, the clinical scenarios come into the picture. Here's a clinical scenario wherein a 35-year-old male presents with chronic cough, weight loss, evening rise in temperature, and chest X-ray shows cavitary lesions. The student has to identify the causative organism. Here, this case requires recognition of symptoms like chronic cough and weight loss and interpretation of the cavitary lesions on the X-ray. So this tests clinical application and not rote memorization. Now here is the same question at the analyzed level with an image. Here the learner must connect the staining characteristics and the bacterial cell wall structure of the tubercle bacilli to provide the correct answer. Now let's move to the evaluate level. Here the learner must recognize treatment response failure, evaluate subsequent steps and apply programmatic TB management. So this tests the evaluation and judgment in patient management and aligns with programmatic management principles. So here we are assessing a higher order thinking skill. Now let's move to the create level. As we mentioned earlier, MCQs for this level of Bloom's taxonomy is very difficult to frame, and but there are still scenarios where it can be created. Here's one. This requires designing a population level intervention and applying epidemiological prioritization. So this is the highest level of Bloom's taxonomy because it tests ability to synthesize concepts into a public health plan. So that's ideal for creating level questions. So what makes an MCQ a good MCQ? A good MCQ assesses one clearly identified concept or learning objective. A STEM is included if the question is at application level or above. The STEM contains all the information that is necessary to answer the question and nothing more. The writing is clear and the task is defined, and always try to follow the WOOF format, which means the web open font format, so that it's easily visible on the screen. There's only one correct answer and the distractors are plausible but clearly wrong. So the question should always be positively worded. Avoid using except and not, and if they have to be used, always highlight and emphasize the same. So the correct answers and the distractors contain no overlap. So every time you frame an MCQ, ask yourself these questions. First, have I avoided negative wording such as except or not in the leading question? Because it makes the question confusing and causes the students who know the information to answer incorrectly. If you have to use them, always, as I said earlier, emphasize and highlight. Second, have I excluded all irrelevant or useless information in the STEM? Because it increases the time to complete the questions without affecting the accuracy. Third, ask yourself, have I avoided turning the MCQ into true or false question or used options like none of the above or all of the above, because it makes the question too easy for the students. Fourth, have I avoided using obviously wrong distractors? Because we have said repeatedly earlier, all the distractors should be plausible, because if not, it allows for easy guessing. Fifth, ask yourself whether you avoided using never or always in the options, because it's easy to eliminate and therefore gives cues to the correct answer. Sixth, have I avoided using wordy or lengthy response option because it increases time and could be giveaway as longer options are usually frequently correct. Seventh, have I avoided making any response option visibly longer or shorter than the rest, because the longer ones could be easily identified as right while the shorter ones would be easily eliminated, because it tends to provide some sort of a cueing to the students. 8. Have I avoided using grammar for response options inconsistent with the STEM, because it allows for process elimination and is confusing. Lastly, have I avoided complex response options like A and B, A and C but not B, because it allows students to use process of elimination to come out with an answers. It tests logic and not content knowledge. Through this module, we wanted to help all our faculty build better, high quality MCQs which test higher order thinking skills. To assist them to do the same, I built this custom GPT called the MCQ Validator Pro, the link for which has been shared in the QR code here and will also be shared in the emails that will follow to you. This application, what it does is you can paste any MCQ that you have framed here in this chat box below here, and it will tell you the following. So assuming now I've just pasted one simple MCQ wherein which of the following is a benign neoplasm derived from adipose tissue. I've given the 4 possible options for the same, and once you paste the MCQ Validator Pro will assess the question and rate it. And along with that, it will also classify the MCQ as per the Bloom's taxonomy level. So the current question that I shared was the lower order thinking skill and was basically only at the remember level. And it will also provide the reasons why it is at that particular level. After that, it will also assess the MCQ that has been shared under the following headings: for STEM clarity, the lead-in clarity, the single best answers, plausible distractors, cognitive level fit, and content accuracy. So it will assess all of them and also suggest corrections for the same if there is any need. Now this is where it gets interesting. In the fourth option for Bloom's enhancement suggestion, the MCQ Validator Pro app will upgrade the question to a higher Bloom's taxonomy level, like it is done here. So this MCQ validator tool helps to ensure clarity of the stem and the lead-in, cognitive level alignment with the intended outcome, plausibility and homogeneity of the distractors, and it will ensure that there are no technical flaws in the question. So this is a systematic item validation, ensures fairness, reliability, and assessment validity. This is free for all, and I request and urge you to use this app well to you frame better and high quality MCQs. Thank you. Signing out from module 5.